Hi, I'm Dr. Shanavas Nishal, and today I'm going to examine your ears. Is that okay for you?
Yeah, okay.
Okay, so first I'm going to check if there is any scars or any deformities or something. Do you feel any ear pain or something, or tenderness or something?
No.
Okay, so now I'll move to otoscopy examination. For that, I'll use an otoscope and tell me if you feel any pain. Okay. While examining the left ear, hold the otoscope on your left hand between the index finger and the thumb, and with the free hand move the ear pinna upward, outwards and backwards to get a clear view of the ear canal. Can I see the other ear? Okay, your tympanic membrane is clear and there are no perforations or any discharge or something, so your ear is normal. Okay. Thank you.
Myself Shirvati Namrata. Today I am performing the test for the hearing loss, which is the Rennie test and the Webber test. Is that okay with you? Okay. First I will start with the Rennie test. In that I'll strike the tuning fork and place onto the patient's mastoid process. And I'll ask my patient when she can no longer hear the sound. Now. Then I will move the vibrating tuning fork and place adjacent to the ear canal and ask patient to tell me when she can no longer hear the sound. Now, so patient is able to hear the sound of the tuning fork which we place adjacent to the ear canal, which means air conduction is greater than bone conductions, which shows the normal. Now I will be performing the Webber test. In that I'll strike the tuning fork and place in the middle of the head of the patient. And I'll ask my patient in which ear she can hear the sound. Both. So our patient heard the sound in both the ears, which means symmetrical with no lateralizations, which is normal. Thank you.
Everyone, so today we are going to perform the nose examination. So the examination is called anterior rhinoscopy, and for this we are going to use the otoscope, and we are going to check the middle and the inferior turbinate and the septum of the patient. So first of all, I will ask the patient that is he comfortable with doing the procedure. So are you comfortable with doing the procedure? So now we will perform the procedure. We will use an otoscope and we will pull up the nose and we will check the turbinates, and as we can see there is no inflammation, so both the turbinates are normal and the septum is also normal. So that's our examination, anterior rhinoscopy. Thank you.
Myself Singh Anubhav from block 10A, and I am going to demonstrate the oral cavity examination. So we will first observe the patient's physical appearance. We will ask the patient to open his mouth, and we will see the appearance of the tongue and the lips, and then we will use a tongue depressor, and then we will check the tongue's appearance and the uvula. We will ask the patient to say ah. We will see the appearance of the uvula, and for any masses, can you move your tongue towards the right and then left. We will check for the teeth appearance and also the tonsils. So we will also observe the soft palate and the hard palate for any rashes or redness. So we will also check for the teeth and the gum appearance of the patient. So we will pull down the lips a little to check the gums of the patient. So after examining the patient, there are no dental caries, and the tongue is in the midline, it is not deviated, and the uvula is also in the midline, and there are no there is no hypertrophy in the tonsils. Thank you.
So in this video we'll be examining the lymph nodes. There are 7 levels of lymph nodes that are to be examined. The first level, it comprises of the submental and submandibular nodes. Here are the submental nodes, and the submandibular nodes are present here. Next, level 2nd, 3rd and 4th, these are present along the lateral side of the anterior cervical chain, behind the sternocleidomastoid. So we'll hold the sternocleidomastoid while palpating the lymph nodes. Here is the upper jugular lymph node, here is the middle jugular lymph node, and here consists of the lower jugular lymph node. For level 5, we have level 5A and B. For level 5A, we have the supraclavicular lymph node, and for level 5B, the lymph node that is present in the anterior border of the trapezius, which goes along the occipital region. Level 6th, we have pretracheal and prelaryngeal lymph nodes. These are present at the front of the trachea. They are not very palpable. For level 7, we have the superior mediastinal lymph node, which is present beneath the suprasternal notch.
In the examination of the thyroid gland, the first step is inspection. First, we should notice the thyroid cartilage, as the gland is usually located below the cartilage. The next step is examination, which is usually done from the back. We can also do it from front. Palpate the thyroid for any nodules or tenderness. We can check the thyroid mobility by offering the patient to sip water. And check for if there is any inflammation or immobility. If there is perfusion problem, we can hear a brood on stethoscope.